Do you have patients stuck on their acid reflux medications, unable to stop taking their heartburn pills? Ever ask yourself if your patients are experiencing long-term effects from chronic acid suppression therapy? Today, I want to talk to you about the possibilities of creating a patient care program that highlights pharmacist-delivered consultation services, nutritional recommendations, and compounding pharmacy services. Today, proton pump inhibitors, or PPIs, are very effectively marketed and widely prescribed throughout the U.S. They're the third highest selling drug class, with 113 million prescriptions written a year, and that's sales exceeding $14 billion. These medications are powerful and effective, and when used as directed, they're a very useful tool. However, most PPIs are indicated for only 4 to 8 weeks of use, and many of us know patients that have been on these for years. OTC therapy should not be used more than 42 days a year. That's 3 of the 14-day OTC therapy courses. Now, with prescription, medication, and over-the-counter availability, many patients are using these therapies longer than what they're indicated for, and not always using them for the right reasons. 53 to 69% of PPI users are using it for an inappropriate indication, and they're not without their risks. There are signs of dependency and rebound acid reflux. In a study, 40% of healthy volunteers developed acid-related symptoms after only 8 weeks of PPI therapy. In the package insert for some PPIs, we can even see that there are stated risks associated with the use of these medications. In the package insert, we see warnings about vitamin B12 deficiency or malabsorption with long-term use. Also, the increased risk of C. diff, associated diarrhea, the risk for bone fracture, as well as magnesium depletion. Recently in news, we've seen some other risks come to light and be shined upon with instances of gastric atrophy, calcium and other nutrient depletions, the progression of kidney disease, and also prolonged PPI use being associated with dementia. The FDA put out a drug safety communication talking specifically about the long-term use of proton pump inhibitors and low magnesium levels. And in this announcement, the FDA stated that magnesium supplementation alone did not improve the magnesium levels in the blood, but that the PPI actually had to be discontinued. So for patients that are on long-term PPI use, just simply adding some magnesium to their regimen is not enough. We actually have to get them off of their proton pump inhibitor. Like we said in the news, we're seeing lots of instances where proton pump inhibitor medications have been linked or associated with many adverse long-term effects. Most recently, we're seeing risks associated with heart attack, dementia, progression of kidney disease, and on top of these, many instances of nutrient depletion along with their associated complications. Patients have heard enough of these medications in the news to know that they want to get off of these medications. Many of them have experienced these adverse effects firsthand, and they're looking to turn to somebody for answers and a way to get off these medications. Currently, the traditional method and approach to getting off of PPIs replaces the proton pump inhibitor with another drug, either an H2 blocker, an antacid, or the occasional over-the-counter PPI use. It's very challenging for some patients, especially if they've been on these medications for long term. Now, it's interesting to see that lifestyle and trigger food indication always seems to be an afterthought in the traditional approach, but many times that's a cornerstone piece of information that the patient needs in order to start their taper of the PPI. There have been studies into the discontinuation rate of proton pump inhibitors for patients that have been on long-term therapy. The conclusions from these studies is that long-term PPI users had a 27% successful discontinuation rate after a year. This shows that there's an opportunity to increase successful discontinuation of PPIs. And this is why we created Ditch Your PPI. It's more than replacing a drug with another drug. It promotes the pharmacist's role in counseling, nutrition, and personalized medicine. We're able to demonstrate collaborative outcomes with prescribers in our community, allowing for a taper regimen that has personalized recommendations and a flexible taper schedule. By combining patient education with personalized recommendations with nutritional support and a flexible taper schedule, we can promote the pharmacist's role in delivering outcomes through personalized medicine. This approach addresses lifestyle factors that could be triggering acid reflux symptoms. It supports digestion to help soothe irritation and prepare the body for success with the personalized PPI taper. In this program, we will engage the entire healthcare team. We can identify patients that have either had adverse effects from long-term PPI use, they've become dependent on the PPIs, and when discontinuing, they find that they're having rebound acid reflux. We can identify patients that have started over-the-counter therapy for occasional heartburn and now find that they cannot self-taper. If patients are using more than 3 14-day courses of the OTC PPI, we can have that conversation to find out what is the root cause of their acid reflux. Another opportunity in identifying patients are when patients are discharged from the hospital and their PPI is continued with no clear indication. After we have identified patients that qualify for tapering their PPI therapy, they'll have a consultation and education session with the pharmacist, who can then recommend nutritional products that will help support their taper, as well as create the PPI taper and dispense it in an easy dosage form for them to slowly come off of their medication, and follow up with the patient, which is crucial in demonstrating outcomes to both the patient and the doctor. The American College of Apothecaries and Ditch Your PPI have teamed up to help patients and providers break the acid reflux cycle. An educational foundation with turnkey solutions to implement this program in your pharmacy with ease and start helping patients fast. You will become a certified endorsed local pharmacy provider and have access to the Ditch Your PPI network and program materials. Online, ditchyourppi.com is a resource for not only your patients, but also your prescribers, where they can reference the website for information and serves as an online presence for you to promote your service. As an endorsed local provider, your pharmacy location will be listed to help facilitate patient access to your services. You will have access to program materials, so that way you don't have to spend your time figuring out what you need to get started, and you can start helping patients this week. Provide a new service to current patients while recruiting from a new patient population. You can generate questions by patients and doctors about the other pharmacy programs offered at your pharmacy, including weight loss solutions, hormone replacement therapy, oral NSAID avoidance with topical pain formulations, and addressing drug-induced nutrient depletions not only associated with long-term PPI use, but also the other medications that the patients are on. Ditch Your PPI and the American Colleges of Apothecary are excited to help pharmacists create a patient care program at their pharmacies and has provided a fantastic package to get you started. For a $695 investment, program participants will receive access to 5 hours of online training, providing foundational information on the pharmacology, nutritional support, implementation, and marketing of starting a patient care program specifically for long-term PPI patients. Upon completion of this certification program, pharmacies will receive a 1-year listing as an endorsed local pharmacy provider on ditchyourppi.com and access to all program materials, including patient and physician directed marketing materials, patient education materials, compounding formulations, order forms, and best practices. You may purchase this program now at www.acainfo.org/ditchyourppi.